Hey, it's Dr. Karen with this week's Hot Topic. Make sure you like this video, follow us on social media, and subscribe to our YouTube channel so you never miss another hot topic. So today I want to talk to you about psoriatic arthritis. So if you don't know what psoriatic arthritis is or you've never heard of it, it's a type of chronic inflammatory disease of the joints and the tendons and ligaments where they connect to the bone that basically happens in people who have psoriasis. So it's not like it's just a random thing. They also typically have psoriasis, hence why it's called psoriatic arthritis. Now, if you don't know what psoriasis is a skin condition that causes these red, scaly, and itchy patches on extensors, so like elbows, knees, or your scalp. So psoriatic arthritis typically appears between ages of 30 and 50, doesn't matter male or female. For some people, it actually starts about 10 years after psoriasis develops. But on the flip side, some people develop the psoriatic arthritis first without even developing any symptoms of psoriasis. So symptoms of psoriatic arthritis, they can develop slowly with mild symptoms, but it can also develop quickly and quite severely. So people who might develop psoriatic arthritis might actually happen after an injury to a joint. Development may also be related to genetics. So it could be something you inherit. So they've done some research and they say about 10% of the general population typically inherits this gene that can create a predisposition to psoriasis. So some of the common symptoms of psoriatic arthritis is just general fatigue. Obviously because you're in pain, you have tenderness, pain, and swelling over the tendons and the joints. Psoriatic arthritis, what they call more of those sausage digits. So your fingers and toes are going to look literally kind of like sausages. So they're very swollen and very thick. Stiffness, pain, throbbing, swelling, and tenderness in one or more joints. Significant reduced range of motion or just reduced range of motion. Morning stiffness, tiredness. You're going to know some nail changes such as pitting or separation from the nail bed. So that's one of the things to kind of look for. But if you already paint your nails, it's a bad thing. Redness and pain of your eyes. You can also have any kind of other things like that you're just like, this just may not make sense. But those are more of the common ones. Now with psoriatic arthritis, you could have a few skin lesions, but you could also have joints that are very severe, like I said. So if you find yourself suffering from psoriatic arthritis, or you know somebody else, I'm going to talk about 4 main things to focus on that can kind of help alleviate some of your pain, because there really is no cure for psoriatic arthritis. So the first one is physical exercise. So exercise keeps your joints and tendons loose and limber, helps you reduce that inflammation and your pain. So building up your muscles decreases the workload on your joints. So anything that's really going to get your heart pumping and your joints moving are going to help lower your risk of developing another what's called a comorbidity. So a related condition to psoriatic arthritis that basically is just going to complicate it more. I've said this in a lot of videos, but exercise is kind of key to everything. So make sure you just get up and move. The second thing is really managing your pain. So the inflammation caused by psoriatic arthritis can have short-term effects such as pain and swelling, but it can be quite severe and very debilitating. So that inflammation can cause that long-term damage to your joints also. So you want to make sure that you kind of have a good handle on that. Stress can also aggravate it as well. So when you have that combination of inflammation and stress, it can make you a little bit more sensitive to pain. So it's kind of this vicious cycle. Now, gold standards, typically non-steroidal anti-inflammatory drugs or NSAIDs, which are over-the-counter medications such like as ibuprofen or aspirin. But you can also get some heavier prescription drugs if the NSAIDs aren't working. Really, it's just going to help decrease that inflammation, help with joint pain and stiffness, just to help make you move a lot better. You can also try some topical pain cream that works really well, especially ones that have that capsaicin in there, which is just from a pepper. So it's going to give you that nice cooling sensation. The third thing that people don't really focus on, but it has a huge significance, is following a healthy diet. So if you have psoriatic arthritis, you want to avoid some of these foods that can kind of trigger this inflammation in your body. So just a couple examples in the main ones of inflammatory foods, if you eat them or drink them, is like alcohol, sugar, processed foods, diet soda or regular soda in general, fried food, processed meats, red meats, and dairy specifically. All these foods make inflammation worse. So really you want to follow like this anti-inflammatory diet. Now, foods that you should probably incorporate into your diet, which is good for psoriatic arthritis, are ones that are going to help keep your inflammation down. So we're talking like fruits and vegetables. So you want to go for more of those berries or those dark leafy greens. So those are high in antioxidants, which keep your immune system healthy and can also help fight inflammation. Something else you want to focus on are beans and whole grains. So not necessarily like the flour stuff, because you want to avoid gluten. But those are going to be high in fiber, which keep your levels of C-reactive protein in your blood. Keep those kind of down and under control. So if you have a high C-reactive protein, it can mean you have a lot of inflammation. So fatty fish, avocados, flaxseed oil, and olive oil, these are all high in omega-3 fatty acids, which can cut down your inflammatory proteins in your body. So you want to boost your immune system, boost your whole system with fish oil, those type of things. You can do turmeric, ginger, and cayenne. So all of these spices also are good for keeping inflammation under check. Green teas, white teas, and black teas, they're high in polyphenols, which can help boost your immune system and just keep that healthy and going. And the last thing that you can think about that I see a lot of is acupuncture. So acupuncture works great for pain relief and inflammation. It can do a whole overall body check, but it's one of those things that people may not necessarily think of as an alternative treatment. Getting adjusted by a chiropractor is great, but you have to be a little bit lower force when you're getting that adjustment, because some of that extra pain and pressure on your joints is going to be a little bit too much, especially if you have psoriatic arthritis. But there are ways to be adjusted if you have that and you want something that's a little bit lower force, a little bit lighter. So that's all I have for you this week. I will see you guys next time.